In this Station 5 podcast, I would discuss a case of neurofibromatosis. In the Station 5, you may get neurofibromatosis type 1 NF1 case or type 2 NF2 case. So before starting the case discussion, I would like to give you some background information of neurofibromatosis. Both of the types of NF are autosomal dominant. Type 1 is due to a mutation of NF1 gene in chromosome 17q. The clinical phenotype are cafe-au-lait patches, axillary freckling, plexiform neuromas, optic nerve and brain gliomas. Sometimes we see retinal hematoma and leash nodules in the iris, and finally pheochromocytoma. For neurofibromatosis type 2, we typically see bilateral acoustic neuromas, which are also known as vestibular schwannomas and meningiomas. Since these bilateral acoustic neuromas occur in cerebellopontine angle, so you would find hearing loss abnormality in the function of cranial nerve 8, which means loss of balance, problem in cranial nerve 5 function, which means the impaired sensation over face, and also cerebellar problems like vertigo, nystagmus, balance loss, etc. So you have a case who complained of skin rash and diminished hearing for last 2 years. We would take OCAD approach to deal with neurofibromatosis cases. So O stands for onset, when this skin rash was started exactly. Then course, was it sudden or gradual? Progression, is it increasing, decreasing or same? Then also duration, is it coming off or all the time with you? Ask about relieving factors and aggravating factors. The relieving factors may be any drugs or medications that helps with the condition, and the worsening factors may be any trauma, stress, exposure to sun, smoking, alcohol, drugs, etc. Then ask the typical rash questions. The typical questions are: is this rash painful? Is it itchy? Is it oozing? Is it blanchable? How many rashes do you have? Do you have similar rashes in any other part of your body? You can examine the patient's rashes while asking these questions. That would save your time. Then you can start systemic inquiry from top to bottom. You can at first ask about: do you have any headache, any vision problem, and also examine patient's eyes for optic glioma, retinal hematoma and leash nodules. Also ask him: do you have any eye pain, eye redness, any problem with your vision, for example double vision, any painful eye movement, any color vision loss, etc. You can ask the patient about other neurological symptoms like: do you have any hearing loss, any mouth angle deviation, any dripping of saliva, any loss of sensation over your face, any loss of consciousness, any episodes of seizure, weakness, altered sensation, unsteady gait, uncontrolled water work or bowel habits, educational difficulties or behavioral changes. After asking these questions, you can examine patient's facial sensation in temporal, maxillary and mandibular area. You can do a Rini and Weber test to assess patient's hearing, and also you can do tests for facial nerve. You can simply tell him to show his teeth and close the eyes against the resistance. Then you can again go back to the systemic inquiry, or otherwise you can complete the total systemic inquiry and then do the examination. During my examination, I did both together. So let's go back to the systemic inquiry. For pulmonary symptoms, ask him about cough, phlegm or shortness of breath and any chest pain, because neurofibromatosis patients can develop lung fibrosis or pneumothorax. From cardiovascular system, you don't need to ask him about chest pain and shortness of breath because you have already asked these during pulmonary system analysis. So here you can ask him about racing or pacing of heart, any leg swelling, any abnormal heartbeats, etc. At this point, you can ask the examiner for patient's BP because neurofibromatosis is associated with pheochromocytoma and renal artery stenosis, and both of these conditions are known to cause high blood pressure. In addition, neurofibromatosis can cause restrictive cardiomyopathy and pulmonary artery stenosis. For gastrointestinal system, you can ask him about any tummy pain, bloating, feeling sick or getting sick, altered motions, flushing, etc. For musculoskeletal system, you can ask him about any kyphoscoliosis, any joint pain, back pain, bone deformity, bowing of long bones, etc. And at the same time, you can also inspect the patient for any obvious deformity. If you find any skeletal deformity, then you have to expose that part and inspect more carefully. Family history is very important as neurofibromatosis is a autosomal dominant condition. So if this patient has neurofibromatosis, there is high likelihood that he would have other family members with similar condition. Next, briefly take some social history. What are you doing for living? How much the symptoms impact your day-to-day life? Are you financially well supported? Do you drink? Do you smoke, etc.? Medical history is important. Do you have other comorbid conditions like diabetes, hypertension, any cardiac problem, any surgical operation or medical admission history before? Are you taking any medications? Are you taking any herbal medications or over-the-counter medications? Do you have any medication allergy at all? Then ask for patient's concerns. The patient may tell you that he is embarrassed due to the presence of rashes, and then you can tell him that we would refer you to our multidisciplinary team, and that team would include a plastic surgeon who would tell you more about the cosmetic management of your skin rashes. The patient may ask you how neurofibromatosis is diagnosed. Then you can tell him that we would do further tests and we would take your complete history. The tests would include some imaging tests like MRI test and genetic tests. And finally, after having all the test results, our nerve doctor would diagnose your condition. Patient may ask you about future babies. Is it possible to diagnose neurofibromatosis before birth? And then you would tell him that yes, it is possible. Before birth or at birth, DNA analysis can diagnose this condition. The patient may ask you about the life expectancy of neurofibromatosis patients. A good answer can be with proper care, the life expectancy of typical neurofibromatosis patients can be almost normal. At last, the examiners may ask you about your differential diagnosis. The differentials can be neurofibromatosis type 1, type 2, VHL or von Hippel-Lindau syndrome, and tuberous sclerosis. If the examiners ask you about treatment of neurofibromatosis, then tell them about the multidisciplinary team approach. For example, cosmetic surgeons may have a role to reduce the skin rashes. The neurosurgeons can also resect some tumors or acoustic neuroma. Neurologists can also prescribe some medications to control his symptoms. Finally, there is also role from neurophysiotherapist.